Are you COVID positive? Have you been advised to be in self-isolation? I totally understand what you must be going through because I am in the same phase. Hi, I'm Dr. Shruti and let's just look at what it is to be in self-isolation. So what happens? What really happens that you end up coming into this phase of self-isolation? Just remember one thing. Please do not ignore your symptom, no matter how small it is. Yes, my first symptom was a sore throat. If you have a sore throat, do not think or do not wait for anything. Please put yourself separate from anybody else in the house. Self-isolation is the best way to reduce the severity of illness from spreading. So kindly stay put somewhere far away as soon as you perceive even the smallest of sore throat and wear your mask as soon as possible. Fever, of course, all of you know the symptoms of COVID-19. Even if I wake you up and say you identify them. Yes, probably towards the end of the first week, you might end up having loss of smell and taste. Severe tiredness is something that is actually taking up a toll on the patients, especially when they are at home, and absolutely unbearable myalgia, body pain. There is a headache, and there could be even burning sensation in the eye, and very occasionally there are some tummy issues like loosies can happen when you are COVID positive. And plus, yes, always remember cough is also a very important sign in case of COVID-19. Now, you have understood the symptoms. So what should you be doing next? It doesn't matter. You need not panic. All you need to do is just pick up that phone, Google the nearest lab you can find, and just make the call. Call. Fix for a house appointment or go to the nearest hospital next to your house where they would definitely do your swab test. It is no big deal. Just get a swab test done. And yes, either if you're in a period of waiting for the swab test, or if you know you're going to be COVID positive, then just stay away from everyone. Just find that room where you can sit alone. Lock yourself in and at least see to it there's kind of enough ventilation inside the room so that it makes you heal better. But remember, if you are not in a scenario where you can find yourself a single sole room, don't worry. Just put on your mask. Just stay away from everyone. Find the sweet spot in your house. Wear your gloves when you're moving around. Ideally, avoid moving around much, but still keep your hand sanitizer handy, and if possible, carry your own disinfectant spray so that you reduce the risk of your dear and near ones getting infected. And don't forget to make that phone call. All right, call up and inform your friends, your buddies, your colleagues, whoever you might have interacted in the past 1 week. Let them know that you are COVID positive so that they too can do the precautions required in order to prevent this disease from moving on to another person. So a quick casual look on what would be happening inside you. So initial 3-4 days, this virus happily lodges inside the back of your throat, or say towards the upper part of your nose, in the backmost part of your nose, and it does nothing much. It only brings about symptoms of an upper respiratory tract infection. So what is this upper respiratory tract infection? Is that it is it hasn't what it shows you that it has not reached the lungs. It is only stuck onto the upper part of your breathing canal, right? And then the battle is beginning. So when the battle begins, the coronavirus and the soldiers of our immune system, that is the lymphocytes, they are into severe fight. And as the battle goes on between these two, just remember, the longer the battle happens, it's good. Battle is good. All the symptoms or signs of the battle have been initiated in your body, but it could end up, the longer it takes, you might end up having an infection towards your lungs. And always keep in mind that infection of the lung is when it is called as the lower respiratory tract infection. And as this battle goes on, the soldiers of our body, they can get confused, whom they're fighting. The fears are so much in them, and they just end up getting confused whom they are supposed to destroy, and might end up destroying our own selves. But this is, I'm talking about a completely different scenario where you would be like, very severely sick. So let's not be worried about that, because we are in self-isolation and we're totally fine. So what should you be doing as a person who are in a state of need only of a self-isolation? Just remember, as soon as you get your report, please get in touch with your registered medical practitioner. There are a lot of people who are just copycatting your friend's prescription because he or she had nearly or recently been tested COVID positive. Do not do that. What you should be doing at your personal level is monitoring your stats. You cannot follow somebody else's medication because his statistics would have been totally different. Just remember that you monitored your oxygen saturation. Remember to monitor your temperature. Keep account whether how much of breathing difficulty you're having. Just keep a close watch upon yourself and identify if you are able to breathe freely. Keep doing the 6-minute walk test. That is, you check your oxygen saturation. It should be, if it's normal, do the 6-minute walk test. Walk around inside your room for around 6 minutes and then check your saturation again. Ideally, if the saturation is about 95, you are totally fine. If you think it is 94 or a bit below that, then have that wake up call in your mind that you might need a hospitalization or oxygen support just to help you recover, right? So what are the equipments that you should be having at home? Okay, pulse oximeter is become like any other accessory that you should have in your purse right now. Yes, please have it. Is coming around 1,000 rupees. If you can afford to buy one, it is the best option. Thermometer, I believe most houses have their own thermometer, and yes, if possible, a BP apparatus, especially in the household where you have senior members who are already having comorbid conditions like blood pressure and diabetes, that is sugar. Now, about blood test. Need not do your blood test on the day you tested positive. Blood test is done to measure the level of action or reaction taking place inside your body after this infection has started. That is, your immune system is acting, and this is just to track what level of activity between the virus and the immune system is happening inside your system. So getting your blood test done on the first, second day might be not a good idea because you would not get the right result. So that ideally takes at least 3 or 4 days to happen. So remember that if your symptoms are pretty evident, you still have symptoms on the 4th or the 5th day, then go in for a blood test. And once again, this will be advised by the contact physician you are with. Okay, get it prescribed by your physician. And generally, what are these blood tests done is a complete blood count. You have a C-reactive protein, D-dimer, and serum ferritin is what is trending right now. Well, these are all inflammatory markers. The swelling inside your cells, they are marked by these enzymes or these components or these chemicals. So these are the commonly done ones. So just remember that monitoring C-reactive protein, it might be elevated in any infection in your body. It just need not be COVID-19. Any kind of blood infection can elevate the C-reactive protein. And the reason why they do a D-dimer is just to keep a track if any clot formation is happening inside your body. So please remember to do these blood tests only if required. Doing unnecessary blood test only increases the panic inside you. About CT chest. Please do not do unnecessary CT chest. Doing a CT chest on day 1, day 2, day 4, 5 is probably worthless because infection might not have reached lungs that very fast. But if you think your symptoms aren't reducing, if your doctor thinks your blood parameter levels are not under control, then the next ideal step would be to go in for a CT scan. That would probably happen around in the 6th or 7th day. But please remember, unnecessary CT scan, you are just getting exposed to unnecessary exposure to radiation. You do not do that, because excess radiation only does harm to you in the future. So kindly avoid CT scan if you are a mild to moderate person in home isolation with decent blood parameter records. So what are the medications that are usually given? Yes, all of you should get your prescribed medicines from your physician. Do not copy a prescription given to another person, because it varies from person to person, age to age. So generally, the universal drug definitely given is an antipyretic. That is our hero star, that is the paracetamol. It's a magic drug. It kills the swelling inside the cells, it kills the pain in your body, and it also brings down the fever. Antibiotic is given along with a proton pump inhibitor. Antibiotic like an azithromycin has been given, and a proton pump inhibitor is given along with azithromycin, so that you don't get any gastric symptoms when you're having an antibiotic. These are the other tablets that are being, or drugs that are being given along. Okay, all of this supposed to be working cohesively to combat the changes in your body produced by a COVID-19 immune reaction. So this has to be given in the right phase. Please kindly refer to your physician whether this is required or not. Having this as early as the first few days in your infection might end up only doing more damage to you. Kindly wait for your blood parameters or wait for your physician signal to start on a steroid like dexamethasone. It is just absolute unnecessary and absolute blind belief. Starting dexamethasone early could actually deteriorate your health towards the end of the healing period in case of COVID-19 infection. So be careful of all of these drugs. But what you must include for sure, no matter what happens, vitamin C, zinc, and any multivitamin. All of these are so good at helping you heal. And just remember that not only you should include, anybody in your household must also include the intake of vitamins as soon as you have started to get or perceive any symptoms of COVID-19. So what kind of diet you should have? Just have a balanced, good diet. I think anybody and everybody knows what diet is good, what diet is required. Have good amount of vegetables, good amount of fruits, and a decent amount of nuts. All that will actually do the deed. Well, don't forget the magic drink. Please have enough amount of water. 10 tumblers, as in a glass of water is equal to 200 ml. At least have 10 glasses of water a day minimum. Excluding any other liquids you're having, keep that 10 tumblers of water just for the count's sake. If possible, mix it with an electrolyte and have, and that will only help you to get past this phase in a very, heal faster. Then what are the special ones? Most of these items are included in our Indian diet. Increase it a little bit more during the 2 weeks of COVID-19 honeymoon period. Turmeric, neem, ginger, garlic, lemon, fenugreek, cinnamon, pepper, honey, amla, and green tea. All of these are known immune boosters with supporting studies. So take it up in your diet, which will really, really boost your immunity. Have a turmeric pepper latte. Put a pinch of turmeric and a pinch of pepper into your milk and have. All that would really, really help you boost your immunity and combat this entire cycle. Now, personal hygiene is equally important. Just because you're sick, it doesn't mean you stop taking bath or do your daily etiquettes. Continue to follow all of your regular routines. Keep washing your hands and keep sanitizing your room wherever you are living in. What happens to the body and mind is that we forget to take care of it as a separate entity. We are so worried about the coronavirus, we forget about ourselves. So keep yourself active, keep moving around inside the house. Do some meditation if you have, if possible, and do a lot of breathing exercise that will actually help you to help the lungs to open up a bit more and get good sleep. 8 hours of sleep is a mandate. Please practice good sleep and keep in touch with your loved ones. Let people know, just understand that even if that person is sick, even if you drop in a text message every day asking how they are doing, it will do wonders to them healing. And yes, some home remedies. Yes, keep sipping hot water. It is a very, very good thing to keep you in comfort zone. Keep steam inhalation at least 3 times a day. If possible, add in some essential oil like peppermint or eucalyptus. That could really open up your sinuses. And gargling is a magical procedure to kill the germs in your throat itself. Add in a little bit of betadine or add in a little bit of Listerine with some rock salt, and that would just do the magic as soon as it gets to work. Now, what happens post-COVID? Might not heal. Some people are back on the foot on like the 10th day. But if not possible, you can anticipate that you have the symptoms. It doesn't mean you will have the virus in your body. You might have the symptoms for up to at least 2 months. You might, very rarely, you might feel tired. You might have the loss of smell and taste. You might have mild cough. And even very rarely a low-grade fever can continue. But ideally, for home isolation, the doctors are right now very clear that 10 days of isolation is good enough, provided that the last 3 days of your self-isolation period is absolutely symptom-free. So if you are free of symptoms for 3 days, then fine, 10 days is good enough. But what is happening right now is I have tested COVID positive. Everyone wants to see I am COVID negative at the end of my isolation period. In fact, that is actually not required, but if demanded, like you want to go back to work and you are in demand that you get a COVID negative report, only then just get it done. Just remember to stay safe. Just because you have an infection doesn't mean you stop wearing your mask. Doesn't mean you not follow social distancing or stop washing your hands and sanitizing. Keep continuing to do all these. Better you stay at home and get your vaccination done as soon as it is available. Don't worry. You need not panic about what's going to happen. Okay? This phase will also pass on. Just remember one thing, that the virus is not moving on its own. We are the ones helping the virus reach another person. So stay at home, be safe. We will all be okay at the end of this phase. Thank you so much. If you have any queries, please drop in your questions in the chat box.